My name is Carrie Roberson. I'm a physician assistant at Primary Care Grand Haven, and I'm going to talk with you about the common cold. The common cold is caused by a virus. There are many viruses out there, but most commonly it's the rhinovirus, and there's 100+ strains of the rhinovirus, which is why adults can get 1 to 2 to 3 colds every year. Kids get many more. The cold can look like other viral infections, such as influenza or, as we know, COVID-19. It can also sometimes look like bacterial infections like strep or pneumonia. Most cold symptoms are mild, typically stuffy nose, runny nose, sometimes a little bit of a sore throat, sneezing. The sore throat usually goes away pretty quickly. Cough can develop, but usually a little bit later, about 3 or 4 days after the initial symptoms start. So if you have severe sore throat, especially with headache or upset stomach, that might be strep. Or if you have a severe high fever and cough that starts right away, that might be pneumonia or something else like influenza or even COVID-19. So sometimes early on, if you're having symptoms that aren't quite suggestive of cold, you're going to want to be seen sooner, especially if you're a vulnerable patient. You might want to get in and be tested for influenza or COVID-19 because we have antivirals that might shorten the course or keep you from having complications. If you have mild symptoms or even moderate symptoms that you think you can manage at home, there are some symptomatic things that you can do to treat common cold symptoms. You can use nasal saline, which can help with congestion and drainage. You can use nasal crom, which is available over the counter. That can also help with some of the congestion and sneezing and even the cough. Sometimes honey can be helpful for cough, but no one under the age of 1. Occasionally, the cough medications like guaifenesin and dextromethorphan can be a little bit helpful, but the studies haven't really shown out, and if you overuse it, you can have side effects. Decongestants can sometimes be helpful. Pseudoephedrine from the pharmacist can be more effective than phenylephrine over the counter, but those medications can also have side effects, so be careful if you have high blood pressure or difficulty urinating. Prevention is the best thing that you can do to keep yourself from getting a cold. Hand washing is ultimately the very best thing you can do. Wash your hands regularly. Wearing a mask, if you do have symptoms, can be helpful just to keep you from giving even the common cold to others around you. So getting a little bit of sunlight every day or taking a vitamin D supplement, especially for people in Michigan in the winter, can be a good idea. Most cold symptoms will resolve within 7 to 10 days, but if you feel like your symptoms are severe or they're progressively worsening or you've gone 2 weeks and your symptoms haven't resolved, then you may want to consider that it might be something other than the cold or even a complication of the cold, which can be sinus infections and ear infections. Because the cold is caused by viruses, we do not treat cold symptoms with antibiotics unless we suspect that it's a bacterial infection. Antibiotics otherwise do not help treat viral infections. If you have any questions about the common cold or really any other medical concerns or questions, please give our office a call.